Has your dog suddenly started walking like a pirate or bunny? Or like they've just woken up after leg day at the gym? If your dog is limping on the back legs, slowing down, struggling to stand up, this video could save you months of pain and unnecessary worry. Today, I'll explain what causes back leg lameness, when physio is enough, and when surgery like TPLO or TTA is actually needed. I'm DrVet, and let's help your dog walk normally again. Hi everyone, welcome back to DrVet. If you're new here, hi, I'm veterinary surgeon, and on this channel I help you understand what's happening with your pet without scary jargon. If your dog is limping, slowing down, or refusing stairs, you're in the right place. So grab a coffee, your dog can grab a chew. Let's talk about back leg lameness. I see fair share of those orthopedic cases, and the reason for that is that this is my area of interest. I do all sorts of surgery, and on daily basis I correct the dog lameness. Not every lameness is serious, not every lameness is actually linked to pain. This is a very important bit which I'm going to explain further in this video. Lameness simply means abnormal movement due to pain, weakness, or mechanical problem. Back leg lameness can look like limping, bunny hopping, stiffness after rest, difficulty standing up, reluctance to jump, sitting down awkwardly, or that classic "I'll pretend I didn't hear you" when you grab the lead. And owners often tell me, he's just slowing down, she's just getting old, maybe she slept fully. And sometimes yes, but very often no. Dogs are masters of hiding pain. If a dog is limping, the problem has usually been there for weeks or even months. So please remember, limping is not normal. Slowing down is not normal. Struggling to stand, it's not normal. It's your dog telling you something hurts. Please help me. How back legs work. Think of your dog's back legs like shock absorbent, engines, and steering wheels. Main problems are hips, knees, lower back, muscle and tendons, and nerves. If one of those parts fails, the whole system struggles. But to be honest with you, the most common problems I see in first opinion practice, this is a knee issue. The knee issue, another word speaking, is a stifle joint. And this joint, because of the anatomy of it, is prone to have all sorts of little accidents leading to the chronic lameness. One of the most common cause of the back leg lameness in dogs is a cruciate ligament damage. The cruciate ligament stabilizes the knee. When it's damaged, the knee becomes unstable. Pain develops. Arthritis starts quickly. Signs: sudden limp, sometimes bunny hopping, sitting with one leg sticking out, or clicking sound in the knee. And no, dogs don't usually tear it playing too hard. I mean, don't get me wrong, there are cases where the dog's playing rough and sometimes they coming back to us on three legs. And yes, this is classic example of the post-traumatic cruciate ligament damage. However, those cases usually building up for months and they lead to the cruciate ligament weakness. And finally, cruciate ligament just giving up. This is not exactly true that the patient always feels pain after cruciate ligament damage. When the patient going through trauma, straight after, of course, there's a pain and discomfort. And then we've got inflammation and swelling following this. But few days later, after giving non-steroidal medication, all the symptoms start settling down. But the patient is still limping. It doesn't mean that it's still in pain. Remember that. So what happens when the dog is not in pain, but it's still limping? This is the case of the physical lameness, it's physical discomfort. And why does it happen? It is because, well, I show you on that bone, however, it's not the best example as I put some implants there. Let's imagine that there's no implants there. So basically what happens is when the patient is walking and having cruciate ligament damage, the distal part of femur goes forward like that, meaning that every step the femur goes forward and is causing of discomfort in dogs, okay? Normally, with cruciate ligament, that should not happen. If the patient has the cruciate ligament there, then the knee is working exactly as it should. But because we lose this cruciate ligament support, then we've got this kind of cranial movement. That's why your vet, when you bring your cat or the dog to the vet, they check in something which we call cranial drawer, which basically we need to obtain this movement to see if this movement exists in this particular patient. And if it does, this is pretty much confirm that the patient suffers from cruciate ligament disease. So then you may say, why my vet needs to take x-ray? Why is that necessary? Is it because they want to make more money? No, that's not the case. We take an x-ray to be absolutely sure to confirm this is cruciate ligament problem or not. But also, it's very easy in that case to examine patient when the patient is asleep. So for the x-ray, we need to prepare the patient. We need to introduce the anesthesia to the patient, and then after that the patient is fully relaxed. When the patient is relaxed, we can actually fully check the joints and check is it any mobility restriction or not. And second thing, we take x-ray, and we take this x-ray to confirm cruciate ligament damage, but also we can do necessary measurement and assessment of the joint. And based on this examination, we can tell you what is the best way to fix your cat or dog. Because without it, it's just a guessing game. So the x-ray and examination under anesthesia is necessary for that particular reason. Because we need to choose, is TPLO is the best for the patient, or MMP, or TTA, or maybe lateral suture? And we can answer those questions after, when we do x-ray. So this is not guessing game. This is precise way of finding what is the best treatment for your dog or cat. Another big one is a hip dysplasia. Hip dysplasia means that the hip joint doesn't fit properly. Doesn't fit. It's very common in large breed, young dogs, dogs that were a bit stiff as a puppies. Signs: stiff after rest, reluctant to jump, muscle loss in the back legs. And the good news, not every dog needs surgery. Another big one is arthritis. Yes, dogs can have it too. Please remember, dogs' body are similar to ours. The same rules apply to joints, therefore to the wear and tear. So as we're getting older, our joints getting arthritic. The same exact things happens to dogs. So no, it's not just the old age. Arthritis causes pain, stiffness, reduced mobility, mood changes. Owners often say, he's just grumpy now. No, he's not. He is sore. Another one is muscle and tendons injury. Think slips, falls, zoomies on laminated floors. Those are often improved after rest, physio, and the time. But if ignored, they can become chronic. Another one, neurological issues. Sometimes the problem isn't the leg at all. It's the spine or nerves. Signs: dragging toes, weakness, wobbling, knuckling. Those cases need urgent veterinary attention. Now, let's talk about non-surgical options. And I love this part because not every dog needs surgery. First, physiotherapy. Physio is not just a message or vibe. It helps build muscle, reduce pain, improve stability, speed up healing. Great for arthritis, post-injury, post-surgery, or mild cruciate ligament, which I also like to call a partial cruciate ligament damage. So what is then partial cruciate ligament damage? It means that the part of the ligament still holds everything in right place. There is small rotation when you check the cranial jaw, but generally the patient can walk on this leg. Of course, you have to be extra careful in those cases, because if the patient doesn't feel pain, feels comfortable, there is only minor instability within the stifle joint, the patient can completely rupture the ligament if you don't rest the patient, if you don't introduce the right exercise regime, like swimming, for example. So this is something to consider, and this is something to talk to your vet. The form of physiotherapy is hydrotherapy. Dogs in water, magic. Why it works? Low impact, builds muscle safely, improve joint movements, and improve circulation. The dogs usually love it. Weight management. This is the most underrated treatment. Majority of lameness in dogs is caused by obesity, because obesity leads to other problems. It leads to the physical problems causing by little tiny accidents. They may not even be that significant, may not even causing your dog or cat crying after accident, but on the long run it causing of the joints damage, and this joint damage is leading to chronic lameness. Even 1 to 2 kilograms extra is massively increased joint pain. Weight loss equals pain relief. Cats are generally better built, so therefore they are more resilient and they don't have as many problems. As for the dogs, again, as I said, obesity plays an important role, and also the way that the dogs are built, and also depending on how the dogs are moving and interacting on daily basis. Another important factor contributing to lameness is actually the breed predisposition, because in certain breed you will see the lameness more often than in the others. Smaller breeds, especially design breeds, they are more prone to have this sort of problem with the back legs. Pain management and supplements. Pain relief isn't given up. Used correctly, improve quality of life, allows movement, prevent muscle loss. Supplements can help too, but they are support, not miracle. Now, surgery, the scary one. Everyone Google at 2 a.m. So first one, TPLO, known as a golden standard to stabilize the knee in dogs with cruciate ligament damage. Pros, very stable, excellent long-term results, great for active dogs. And cons, well, big surgery, big cost, and recovery time. Another form of it is TTA. TTA is another stabilization surgery. Pros, less invasive than TPLO, faster recovery. Cons, not suitable for every single dog. And then good and old-fashioned lateral suture. Smaller dogs often do very well with this. Pros, less invasive, cheaper, good results in selected cases. Cons, not ideal for large active dogs. So surgery or not? There is no one-size-fits-all answer. We decide based on size of the dog, age, activity level, severity, owner expectations. The best plan is always individual, honest, and tailored to your dog. See a vet urgently if sudden severe lameness, crying in pain, unable to stand, dragging legs, rapid deterioration. So remember, your dog isn't lazy. Your dog isn't stubborn. Your dog isn't just getting old. Your dog is communicating with you through pain, and the pain is the only way they can. And you're noticing it? Great. It already makes you an amazing owner. So if your dog is limping, don't wait. Early treatment means less pain, less arthritis, and better outcome. If this video helped you, hit like. If you want to understand your pet better, subscribe to DrVet. New videos every week, twice a week, helping you to spot problems before they become emergencies. I'm DrVet. I help you to help your pet. I'll see you next time.